Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 176. A 42-year-old man, a worker at the meat processing factory, developed an itching spot on his lower jaw, which gradually transformed into a slightly painful carbuncle 3 centimeters in diameter, surrounded by a painless swelling that reaches the clavicle. Temperature is subfebrile, under 37.8 degrees C. The doctor suspects anthrax. What drug should this man be prescribed for treatment? A. Azidothymidin, Zidovudine. B. Biseptol, Co-trimoxazole. C. Interferon alpha. D. Levomycetin, Chloramphenicol. E. Penicillin. Anthrax is an infection caused by the bacterium Bacillus anthracis. Types: cutaneous anthrax, Hyde-Porter's disease, occurs on the skin. Presents as a boil-like skin lesion that eventually forms a painless ulcer with a black center, eschar. Most common, least dangerous. Injection anthrax, identified in heroin-injecting drug users. Symptoms may be similar to cutaneous anthrax, but there may be infection deep under the skin or in the muscle where the drug was injected. Inhalation anthrax. During the first few days of illness, prodromal period, most people have fever, chills, and fatigue, possibly accompanied by cough, shortness of breath, chest pain, and nausea or vomiting. Symptoms of the second stage include high fever, extreme shortness of breath, shock, and rapid death within 48 hours in fatal cases, that develop suddenly within hours or days after the first stage. Gastrointestinal anthrax, most often caused by consuming anthrax-infected meat. Symptoms include diarrhea, potentially with blood, abdominal pains, acute inflammation of the intestinal tract, and loss of appetite, and occasionally vomiting of blood. Lesions have been found in the intestines and in the mouth and throat. Treatment: the patients in serious conditions need to be hospitalized. They may require aggressive treatment, such as continuous fluid drainage and help breathing through mechanical ventilation. Antibiotics, antitoxin. Antibiotics. It is important to get medical care with antibiotics as quickly as possible to have the best chances of a full recovery. Ciprofloxacin, quinolone antibiotics, doxycycline, tetracycline antibiotics, levofloxacin, fluoroquinolone antibiotics, penicillin, e.g. amoxicillin, amoxicillin clavulinate. Antitoxins. When anthrax spores get inside the body, they can be activated. The bacteria can multiply, spread out in the body, and produce toxins that cause severe illness. After anthrax, toxins have been released in the body. One possible treatment is antitoxin. It is given in addition to antibiotics and helps eliminate the toxins caused by the infection. Roshibacuimab, abiltoxaximab. For inhalation anthrax. Anthrax immunoglobulin, neutralize the toxins. The answer is E. Penicillin.